Okay, this is the third version of HESI mock anatomy. I will point out, since you have taken this test, if you are watching this video, you should have this test done. And depending on how you've been studying and how you've been working on your thought processes and how effective you've been in this particular arena, this may have seemed really hard and it may not have. So I wrote this mock differently. I didn't write it to be easier or harder. But I did write it differently. So I kept the number of questions close to what you're really going to have. On HESI anatomy, I always have a little bit more than what's on the real test, which is 25 questions, because I want you to get a little bit more practice, but I want to be close in ratio to what the real quantity is so that we can see a realistic number. So in this case, I did the same length that I normally do, but I kind of packed in extra questions by making a lot of questions that have 2 blanks or even 3 blanks where you have to put multiple things together. And I did that because I think by the time you've seen anatomy mock 1 and 2, so you've seen where you can kind of expect to score and where your specific weaknesses are, this one is aimed at getting you thinking a little bit more and getting you to start looking for those weird little tricks and weird little wordings and indicators that are in the questions or indicators that are in the answer choices that can make it easier if you're very aware of them. So if you felt like this one is hard, that's totally okay. And you're probably still in a very good place, because I made this one hard in a very strange way. And the aim was to get you thinking about how certain things relate to each other, looking for little details that can help you dismiss answer choices and stuff like that. So I will go as fast as I can without taking away part of the explanation here. So anytime that there's answers that can be very easily eliminated or answers that are close to each other, I will explain that so that I can basically explain the things to you that I was thinking and trying to do in writing this. And there are a few potentially questions that I might tell you not to worry about the point specifically, since there are a few extra questions. There's a few things that I put in here just to make you aware of them, kind of like I did with the other mocks. Number 1 comes out of Anatomy 5. These are special movements. And you don't need to know all of these by any means. My recommendation with these, we did a question about this in one of the other mocks with, like, if you were wearing high heels, what would you be doing? My goal is that you can see the prefixes and suffixes and how the words flow together and have a general idea of the diagram that's from Anatomy 5. And between those two things, you can figure out probably on the spot whether it's extension or flexion, and then how you can be more specific with it. So you don't need every little thing memorized. You need to be able to think about a movement in a particular area and decide what articulation the movement is. In this case, when you look up at the ceiling, that is hyperextension. There is no such thing as hypoextension, because if you're extending by default, hypo is not a valid word to use to describe that. So really here you had flexion and extension, and you really had to decide, if I'm putting my neck basically backwards to look up at the ceiling, am I extending it or am I flexing it? Hopefully you thought that must be extension. Flexion is bringing your chin towards your chest. So flexion is often closing a gap or creating less space. And then extension is kind of creating more. So hyperextension would refer to the fact that you actually take your head quite a ways back to completely look up. So extension would be when your neck is sort of in its normal position. So your neck lives in an extended format. And then hyper is like you extend it even further, where it would have been flexion had you put your nose downward. Sagittal section divides the body into what sections? Also from Anatomy 5. So sagittal is the one that creates a right and a left side. The only other answer that you could have gotten mixed up with here is the halves, which is choice D. If I were actually able to say, oh, half of the body is over here and the other half is over here, if I were to have a right half and a left half, I would have had to have had medial specified. So a medial cut is a type of sagittal. A sagittal is anything that you cut that creates a left portion and a right portion. A medial cut is perfectly down the middle of the body to where you literally have a half that's the right half and you have a half that's the left half. Since they didn't say medial and they just said sagittal, we have to be broader here. We cannot assume that we have halves. And this doesn't specify whether it's upper and lower halves or right and left halves. That's the other problem with it. If this did say right and left halves, we couldn't pick it because we don't have enough info to say that we have it that perfectly cut. We could have cut all the way over to the left side and have a much bigger right portion. We don't know because all they said is sagittal. The bottom line out of this that I want to make sure you know, because if you're taking this mock, you're very close to testing, is we have 3 basic cuts that are included in Anatomy 5. We have sagittal, we have frontal, and we have coronal. That's really what we're going for here. There always has to be a very specific scenario for you to ever say halves or any specific number. So you just need to know that sagittal would create right and left portions. Frontal would create front and back portions, or dorsal and ventral portions. And then coronal creates top and bottom. If you know those, or if you can easily go back and make sure you know those, that would be the point of how I wrote 2. Number 3, blank can be found in a joint holding 2 bones together and would attach to the blank of bone. So this is from Anatomy 1. You do need to know your bone parts and your bone landmarks. So that was part of my goal here, is to know what is the diaphysis, what is the epiphysis. You'll see on the next question that we're looking at the osteums. So we just want to make sure that you know, just sort of like if you could picture a long bone, what are the different parts of that long bone that we can identify. The 2-part questions are best answered by, and especially the 3-part, because you're going to see some 3-part questions too, by choosing the thing, the part, the half, the blank, whatever you want to call it, that makes the most sense to you or is easiest for you to recall, because you can get rid of a whole bunch of answer choices, maybe even all of them, just for knowing one of the 2 answers. So don't get worried or nervous when you see that there's 2 blanks. That does make the question harder, but if you are strategic, it can make it easier, because you might only have to know the first half and it might answer the second one. There's not a whole ton on the HESI of these double blanks, so that's one of the regions where I made this last mock a bit harder and a bit more thought-based than what you're really going to run into. So you'll do whatever you do on this mock, you'll do quite a bit better on the real test and more similar to how you performed on mock 1 and 2. This is aimed at really getting you thinking, connecting things together. So I put a ton of things in here that have 2 blanks. And that's not super common. If you're going on to take T's, you will see a lot more of those double and triple blank questions on T's. So it's good practice if you're headed that way. If you're not, always look at the 2 parts and pick one that you're most comfortable with. Eliminate answers that don't have a correct answer in that spot, and then you'll either be down to a couple of answer choices, or you might completely be done and you only had to answer 1/2 of it. In this case, when I see something can be found in a joint, so when I look at the first blank, I'm like, yikes, that could be a couple of different things. So I kind of gravitated toward the second blank in this case, would attach to the what of bone. So they're saying when you're in a joint, what attaches to the bone. So for me, I think of my landmark picture, and you had your long bone. It kind of looks like this. I'm a terrible artist. And right here, you have the epiphysis on both ends. Epi means outermost, so epiphysis is each end of the bone. And then in the middle, you have the diaphysis. And in this case, if we're in a joint, so we're in a joint where this meets the next bone, or we might be here where it meets the next bone that way. That is an important factor. we don't know which end we're on. So they didn't say we're connecting the femur to the hip or we're connecting the femur to the knee. The reason that that's important is we do not have enough information to say the proximal or distal. We only have enough info to say, well, joints only exist at the ends of the bones. So the end of the bone is the epiphysis. That will allow me to get rid of B and D because I know that it cannot be the diaphysis because the diaphysis is in the center of the bone and would not be able to be part of a joint. So for me, it was easier to get epiphysis. Now, I noticed right away, and you may or may not have because we all think differently, that proximal epiphysis goes further than what I actually know. I don't know if this is the knee against the femur or the hip against the femur. I don't even know what bone we're talking about. So if I don't have that kind of info, it could very well attach to either of the epiphysis. Every bone has two different epiphysis because it's got two different ends. So I know that I can't answer the one remaining possibility, which is this one here. Now, if that didn't pop out at you, if you weren't sure whether you could say proximal or not, then you go to your other blank. What can be found in a joint? So if you worked off the first blank first, and you may have, you might have been a little bit torn between B and C, because when you think about a joint, you might think of tendons in relation to a joint, and you might think of cartilage. A tendon, remember, connects muscle to bone, not necessarily at a joint, just anywhere that a muscle connects to a bone. So the problem with tendon is we don't see muscle as part of this connection at all. And then we're specifying that we're located in a joint. So in this case, hopefully you remembered that at the site where those epiphysis are on each end, there is also cartilage there. Cartilage is what makes up joints. Every joint, the discs in your back that are between the vertebrae, those are joints and they're made of cartilage. In your knees, in your elbows, in your fingers, all of the joints of your body have cartilage in them. So bones don't touch bones, bones touch cartilage, and then the next bone is also touching that same cartilage. And then they connect at the ends, which would be the epiphysis. So that will make that one C. Number 4, the sheath lining the outside of the bone is called the, and this is also from Anatomy 1. This one, hopefully you know this right off the top of your head, because this is one of the ones I really pointed out as being important, that the periosteum is the lining that's around the outside of a bone. If you knew that, you answered it and you're on with your life. If you didn't, you might have remembered that peri is a prefix that means out, outermost, or outward. And that helps because you know that endo means inner. So the endosteum would line the inside of the bone, not the outside of the bone. And they said outside. And then epi actually also means outward. But as we can see with this example, there's more than one way to use the term outward in looking at anatomy. So epiphysis was the choice here. We know that that means it's at the end of the bone. So that's the wrong kind of outward. We're trying to look at superficial versus deep outward of the different layers of the bone rather than looking at its landmarks. So that gets rid of D. Bone marrow is inside the endosteum, so those two are connected. But bone marrow is not a sheath lining the outside of bone. If you ever feel like you get down to 2 answers and you're not sure why one of them would be wrong and the other not, always go back to the wording of your question. Sheath lining is key here. So if you were focused on the outside of the bone and you had epiphysis and periosteum left and you didn't know how to pick between them, hopefully you would reread the question and go, oh, sheath. So an epiphysis is not a sheath, and a periosteum is. So I talked about a lot of different methods there. You can always pause my mocks and back me up 15 seconds to hear it again, because if you're totally confused, it might come across like tons of random information. But one of those thought processes should be the one that you used, possibly multiple of them. So use your words to determine what a certain word means. If you can't remember on the spot, use things like peri and endo and epi. Use the context and the hints that are in the question of how they describe something, and that should get you to one answer. 5 says the patella is blank to the femur and the ulna is blank to the radius. And I put a hint in here, which they wouldn't, but I did, that make sure you're in anatomical position when you're dealing with ulna and radius. They'll use those because it's so easy to look at your arm sitting there with your hand on the mouse at your computer taking your test and forget that your arm is flipped upside down when you're in anatomical position. So your palms face forward, which totally changes whether the ulna would be considered medial or lateral. So make sure you're in anatomical position. You can use anatomical position in the testing center. Nobody will mind. I definitely gravitated to the ulna and radius as the one I wanted to answer first, because I noticed right away, and again, we all think differently, that the patella versus the femur, I can think of 2 ways off the top of my head that you might compare those that are totally different. This one, ulna and radius are next to each other. There's only one way to look at that, which is that one of them's closer to the midline, one of them's further from it, which is medial and lateral. If I am in the anatomical position, and remember that the radius is where your pulse is, which is on the thumb side of your hand. So if you're in anatomical position with your palm facing forward, your pulse is on the outside. So that would make that lateral, and that would make the ulna medial to the radius. The ulna in anatomical position is closer to your midline than the radius is. So in this case, that answers my question. But of course, always check the other blank just in case you were thinking wrong on the first blank. But it will, if you pick one that you're good at, it will typically eliminate all of the answer choices or almost all of them. So that is something, using that strategy and picking the blank that you're most comfortable with first, I cannot overstate the help that that can provide. Now I go to patella and femur so that I can check myself and make sure I didn't mess up that second blank. I can think of 2 ways that they describe those. So the question really is, well, in the answer that I'm wanting to choose, they're describing it as inferior, which would be below. Is it true that the knee would be inferior in terms of the height of your body to the femur? Yes. So inferior does work. And since we only had one blank that had the right answer for our second half, that is all that I really need to do, is just validate that. Had it been a little bit harder, the other answer I'm thinking of, because probably half of you know what the other one is and the other half of you are like, what else is there? What else there is that the patella would come out from the femur, like further forward, further toward the front of the body. So in a sense, although inferior and superior is the best way to describe the patella in relation to the femur, you could also potentially say that the patella is anterior, a little closer to the front of the body, versus the femur. They would never have both of those there. They would not put medial here and make you choose between anterior and inferior, because literally it could be either of those and there's no way to prove that it's one or the other. So essentially by picking the best blank, you'll either get down to one answer or 2. And then let's say we had another answer. Most likely it'll be something that's very obviously wrong. Like it'll say that the patella is, you know, dorsal to the femur, something that's very much wrong. I actually just thought of a third one though that exists, which is that the patella is distal to the femur. So the patella in relation to the femur is a little bit anterior, a little bit closer to the front of the body. It's a little bit more distal, so it's further from the point of attachment, which would be the hip in this case. And then it is inferior because looking at the height of your body, it is beneath the femur. So they're never going to make you decide on something that difficult. Don't worry about that. It's just going to be a matter of knowing very well what one of them is doing and then eliminating the rest of the answers because of your knowledge of one of them. So I used the double blanks here to to encourage you not to panic when they do something like that that seems at a glance like it's harder because they did that. Sometimes it's actually easier because you wind up answering a really easy question because you're only answering half of it. So you'll keep seeing lots of those. If you do happen to want to, you can always go back now and kind of look at some of those 2 blank questions again and use the strategy I'm talking about and answer them or verify your answers yourself before I give you them all. So if you feel like you performed poorly on the multi-blank questions because they kind of freaked you out, you can totally stop your video walkthrough if you have the time, go back and reassess them and determine, is there one part that makes more sense to me than the other? And does that impact how easy it is to answer it and what my answer is? And then you can resume your video. 6 is the most muscular chamber of the heart, which would be from anatomy 4 and 5. So the most muscular chamber of the heart is the one that has the hardest job. You know that it's got to be a ventricle. The atrium are not, the atria are not known for being muscular. They just kind of slow blood down. They're like the assistant to the ventricles. The ventricles are the ones that are pumps. So between the 2 pumps, what would determine the one that was more muscular than the other is how far does the blood have to go when that particular ventricle pumps. Well, the left ventricle, the blood has to get all the way up into the brain and all the way down to the toes. The right ventricle just goes to the lungs, and that's much closer, so it requires less muscle. So the most muscular chamber of your heart is your left ventricle because it's pumping to the body. The sebaceous glands release blank and are blank to the sweat glands. Again, probably one of these is easier for you to picture than the other. Most likely what the sebaceous glands release is the one that's easier. So sebaceous glands release sebum, as the name implies. There's actually only one answer that has sebum in the first spot. There is one other answer that has sebum, but it's written backwards because the first blank is what the gland releases. The second blank is where the gland is. So A is backwards. You can tell that right away. C and D have the wrong thing being released. Again, double check your other side, but this will help you remember something that's kind of hard to remember, which is that your skin looks like this. You got the epi layer there. You got the dermis here, and then you got the hypo here. Your sebaceous glands are here. They're fairly close to the epidermis. Your sweat glands are here, and they're fairly close to the hypodermis. It is important to be able to picture those glands because they look different and they function different. They're in different spots, but they are both in the dermis. So sometimes you'll get a simple question, what layer are the sebaceous glands in? You might even get a 2-part that asks which layer they're each in, and you would just have to say dermis, dermis. But if you get the very hardest possible question, which is a low chance, but it can certainly happen, they're going to have you compare them. So you would say that the sweat glands are deep to the sebaceous. You would say that the sebaceous are superficial to the sweat glands. So is superficial the right answer in the second blank? Yes. So they release sebum and they're superficial. Always be very careful which way the sentence reads because needless to say, there's 2 opposite answers that are very easy to mix up because it says the sebaceous are blank to the sweat. So in this case, I'm describing where that is in relation to that. All they would have had to do is switch one thing around and I would have been describing that in relation to that. So just be careful of that detail. That is from Anatomy 1. I'll try to keep remembering to label those so you can go back and review. Number 8, the cochlea is part of the inner ear. That's from Anatomy 5. There is no medial to the inner ear that's a part of the ear like the cochlea. So you know that you're outer, middle, or inner. The cochlea is essentially the furthest inward. You can see that on the diagram. That's your eardrum. That's like the last destination that sound gets to. So it's the furthest in, but it is considered the inner ear, not medial to the inner ear. The muscle tissue found in the heart is blank. The muscle tissue found in the digestive tract is blank. And then the bicep. So heart, digestive, bicep. Again, pick one that you're comfortable with. This is 3 blanks, but they'll be reasonably easy to fill in. What I would say I would be most comfortable with is the muscle tissue maybe found in the bicep, since we know that that is skeletal because it's voluntary. You probably think of both of these pretty readily as being smooth muscle. The challenge of this question is remembering that these are both smooth, but the heart has cardiac smooth. And, you know, they may or may not actually have an answer there that gets that specific. But if they do, if that is a possibility that you can say cardiac and all the other parts of the question are right, you want to be more specific. If one of them does specify cardiac, but there's other things wrong with the answer, then you might have reason to be broader. So you have to hold those opposing thoughts of sometimes I want the most specific, sometimes I want the broadest. Best thing to do is make sure you know both of them. Make sure you can answer a question really broadly, and that if you need to get a little more specific, you can. So smooth muscle is a group of muscles that are involuntary, including cardiac smooth muscle. If you are specifically talking about the heart, it may be necessary to actually indicate that that is cardiac smooth muscle instead of just smooth muscle. If they're being a little bit broader with the answer choices, because it always depends on what your choices actually are, then you might say that it's just smooth, because that would be correct. It would just be a little less specific than how far we actually know. So in this case, A is the answer. They did specify cardiac. Digestive, you can't specify a type of smooth. Digestive is just smooth muscle. And then the bicep would be skeletal. So cardiac, smooth is in parentheses, so that if you were a little bit uncertain there, hopefully you saw that and you were like, oh yeah, because cardiac is a type of smooth. All the others are wrong. If I started with skeletal, in this case, I would have eliminated B for that. And then if I knew that this was not skeletal because this was involuntary, I could eliminate D, and so on. Use your thought processes in whatever way is most logical to you. This would be from Anatomy 1, right up at the beginning of Anatomy 1 with tissue types. Where does fertilization occur in females? That is from Anatomy 3, reproductive, and that is fallopian tubes. Fertilization and fallopian tubes both start with the letter F, so that is the easiest way to remember that. Pituitary gland is located in what relation to the hypothalamus and manufactures what? And then hypothalamus manufactures what? Again, seems really complicated, but just pick one. So they've got one that's locating where is the pituitary versus the hypothalamus. That's probably one that you are familiar with if you're familiar with the portal system and the fact that the hypothalamus drops hormones down and they go into the pituitary right below it. So the pituitary gland is right below the hypothalamus, which scientifically would be it's inferior to it. That's where I started because I personally can remember what those two look like. You have the hypothalamus here, and then you have the pituitary literally just sitting right under it. If you're not so familiar on the anatomy side, you might have started with what are the hormones? They didn't say that you needed to list all of the hormones. They just said pituitary manufactures this, hypothalamus manufactures that. So you don't need to be listing a particular quantity of them. You don't need to be listing all of them. All you're trying to do is eliminate things that are incorrect. That's all you need to do. So like I know that oxytocin is released by the hypothalamus. So I could get rid of C because we have that wrong. I can also get rid of C because of dorsal. So since I chose inferior first and I looked at the locations first, that takes care of everything. All I had to do here was verify that pituitary does release FSH and LH, and that hypothalamus does in fact release oxytocin and ADH, and that is correct. And that is from Anatomy 2, endocrine system. 12, corpus luteum forms during what time and releases what is from Anatomy 3. So hopefully you remember that it's ovulation because we talked a lot about that part of it. And then it releases just progesterone because remember that the corpus luteum forms right as ovulation is starting, and it releases progesterone because progesterone is what readies the uterus for pregnancy. So the very moment in time that you have ovulation about to happen, you have fertilization at its most likely point of any time, any point in time. So progesterone is going to be a really important hormone because that's going to do all the final things that are going to get the uterus ready in case fertilization does occur because ovulation is happening. So that one is A. It is true that estrogen and progesterone are involved with the process. It's true that they're released close by each other, but when they specify corpus luteum, they are specifying ovulation and they are specifying just progesterone. The respiratory system is primarily responsible for what, while the cardiovascular system is primarily responsible for what? This one might be a bit of a toss-up for a lot of you, where either of them could be fairly easy to answer, but maybe a little tricky. I like cardiovascular because I feel like it's really easy to describe what the cardiovascular system does. So I'll look at that first. I'll look at the second part of the answers first. There's carrying O2 to tissues. Immediately, I can recognize that that's part of what cardiovascular does, but it's a very specific description where I might be able to find something more inclusive. More inclusive would be like what's in B and C, transporting substances around the body. Proteins, hormones, enzymes, oxygen, CO2, all of those things are transported by cardiovascular. So, and then filtering blood is incorrect. That would be the kidneys. So I can get rid of D because I have something incorrect. Right now, I'm going to keep A, B, and C in place so that I can determine what the first half looks like, but I know that I like this better. I like B and C better if assuming the first part of the answer is right. On C, very hard to notice, very tricky, but they interchanged CO2 and O2, saying that we bring in CO2 and we take out O2. So hopefully you notice that because that gets rid of that for an error. And that leaves me with bringing in O2 and removing CO2 as both of my first parts. Bringing in O2 and removing CO2 is a great way to describe the respiratory system as its primary responsibility. What you wouldn't want is to just say it brings in oxygen or to just say it takes out CO2 because it's very much both. They're happening at exactly the same time and it's an exchange. So you want to have both of those there. Or you want to have something more general like, oh, it does gas exchange, because that's another way of saying both of those. So what this means is that I'm picking between A and B based on this right here, which was the first thing I noticed that I wanted was to be more inclusive with cardio. So B is a better answer because it says more about what the cardiovascular system does. A is misleading because it's got a very narrow frame for what the cardio system does, and it has a very wide frame for what respiratory does. We want them to be along the same descriptive line. That is from Anatomy 4. Urinary system is responsible for all of these. As long as you read all the answer choices, you probably immediately realized it was all of the above. If you didn't answer all of the above, there's like a 90% chance that that happened because you didn't go all the way through the answers before you picked your answer. So if you made it to here, you probably thought, oh yeah, you're right, it is all of the above. If you didn't make it to here, you probably answered like B would be the most likely one, and then you were leaving something else out. So the urinary system does all of that. The lobe of the brain responsible for intelligent thought, some movement, and behavior is the what? And this says lobe of the brain. So there's 4 lobes that are possible. They're listed right here. And then it says, while the area responsible for critical autonomic functions, we're talking like breathing and heartbeat, is the blank. This says area and this says lobe. You'd probably never notice that. It would probably never become important. But if you have 2 answers that you feel are very close together, sometimes there's a hint in how they worded the 2 different halves. This is an area which allows me to infer that maybe it's not a lobe, so they couldn't call it a lobe like they did up here. In this case, that's what turns out to be true. I would imagine most of you went for this one first, because hopefully you know that the brainstem is what controls those autonomic important critical systems. If you did do A and B first, you got rid of C and D. You might have known right off the top of your head that the frontal lobe is intelligence. And if you did, you might have answered that first. So the only one that lines up function-wise correctly is the frontal lobe doing intelligent thought, some of the movements and behaviors, and the brain stem doing critical autonomic functions. That is from Anatomy 2 and a little bit of 5. 16, don't be frightened by this question in the sense that you're like, oh no, am I supposed to know what every nerve does? No. There are a lot of nerves that they can ask about, cranial nerves in particular. These are both cranial nerves. They don't so much focus on spinal nerves. When they focus on cranial nerves, these are covered in Anatomy 5 as well. They're going to focus on ones that have a reasonably obvious name and function. So like the optic nerve does sight, and you can tell by its name probably that that's the case. The olfactory does smell. You may or may not remember right off the top of your head that olfactory is a weird word that means smell. I always, for whatever reason, I always think of it as there's a restaurant called the Spaghetti Factory. And I always think of like you walk into the spaghetti factory and you smell spaghetti. But remember that word because they could use olfactory on all kinds of things. And if you know that olfactory is smell, you'll always have the answer. These two that I included, I didn't make them as easy as like optic and olfactory. I made them ones that you're probably less familiar with to allow you to really pull the words apart. And I'm definitely hoping that that is what you did, because both of them actually have a fairly obvious word part that makes it obvious what they do. So like vestibulocochlear, hopefully you noticed cochlea. Well, that's hearing, right? So that would get me down to B and D. One of them says hearing and balance. The other says hearing. Hearing and balance are both ear functions. They're both things that happen within the ear canal somewhere. It just so happens that the vestibulocochlear nerve does not do balance, but you do not need to know that off the top of your head because the other blank is going to answer this for you. Glossopharyngeal pharynx is what's hidden in there. So if you think about the pharynx and what the pharynx is part of, that would be part of the throat. Essentially, it is the throat. So you would want something like swallowing. In this case, they listed everything that this nerve does, which is swallowing, saliva regulation, and taste. The way that you know that it's appropriate to have all of that listed out and the way that you know you don't want to have balance listed here is all the answers that have alternatives to that are wrong. So B has hearing and balance, which you might think is what the vestibulocochlear does, but sight definitely doesn't sound like what the throat does. So that takes B out. And then eye movement is definitely not what the cochlea would be associated with. So although you see swallowing here, eye movement is not what you're thinking for the first part. And that leaves us with the vestibular cochlea does hearing, and then the glossopharyngeal does swallowing, saliva, and taste. Just a reminder, you guys probably know this, but whenever there's two blanks, they put a semicolon between them. And so wherever you see a semicolon is literally separating the blanks from each other. If there's commas, those are part of the same blank. So because they listed 3 of them here, they put commas between them, but you can tell what goes with what blank because the semicolon is what separates the blank. The types of vertebrae found in the spine are, this would be a combination of Anatomy 1 and 5. And I added a bonus. I added it as a bonus because I don't want you to take points from yourself for not knowing the numbers. You do need to know right off the top of your head that it is A. Remember, we're going from superior to inferior. Always have to be very careful when directional terms are used because it's so easy to accidentally flip them. So if we're going from top to bottom, we start at the neck, which is cervical, then thoracic, which is in the chest area, lumbar is the lower back, and then sacral is the lower back, and coccyx is the tailbone. The bonus, how many each? So cervical is 7, thoracic is 12, lumbar is 5, sacral is 5, and coccyx is 3 to 5. These two are fused. You probably kind of remember that from anatomy. So when you're describing the sacrum or the coccyx, you're describing them as fused, but they still do have a number. The other 3 are those numbers. You can totally write those down. Some of you have those memorized already or still. Some of you don't. It's very unlikely that you would need those numbers, and you certainly wouldn't need all of those numbers. You would get asked about perhaps one of them, like how many thoracic vertebrae are there. If you're feeling really good about what you've got studied, you're feeling like you're caught up, you've got everything pretty much mastered, and you can handle a little bit more, then the teeny tiny 1% chance that they ask for quantity, you can get that right by having this memorized. So write those down real quick if you want them. 18, when considering the entire arm. So I was really specific there so that you can't get your terms mixed up. The radius is what to the metacarpals. When considering the lower leg, the fibula is what to the tibia. So we have 2 different contexts. This is Anatomy 5 as well. So when considering the entire arm from shoulder through fingers, so they want to know, how does the radius compare to the metacarpals? You might have thought either one of these 2 blanks was the easier one. Personally, just like I did when we had radius and ulna, I would start with lower leg, because there's literally only one way you can describe the fibula and the tibia relating to each other. So I'll answer the second blank first. If you're opposite from me on these, as long as my explanation is making sense to you, but you did it flip-flopped, that's completely fine, and you'll get the same result as far as how much you'll be able to eliminate. So the fibula is the part of the lower leg that's on the outside. It's the smaller bone, and it's the one toward the outside. So that would make it lateral. There's really no other way to describe fibula and tibia. You cannot describe one as being on top of the other, so that takes out A. You can't describe them as being proximal or distal because they're the same distance from their joint, so that takes out B. And then medial would be backwards. Now, there is an okay chance that you might not be able to remember which one is which, and you might know that they would be lateral or medial, but not know which. So let's assume worst case scenario for a moment and say, well, you were able to eliminate it being on top or bottom, or being closer or further to the knee, but is it lateral or medial? So then we can go back and look at how the radius relates to the metacarpals. The metacarpals is probably not something you can totally and completely picture right off the top of your head unless you've been working really hard on skeletal, but hopefully you know that carpal is around the wrist or hand. So the word carpal, most people know that word from carpal tunnel, which is what people who type or do something that really uses dexterity for many years develop. So when you hear the word carpal, you think of the hand and wrist area. The carpals are the bones basically right. They're very close to the radius. They're right next to the radius going into your hand. So the beginning of your hand where it meets your wrist. Again, there might be more than one way that you could describe how those relate to each other, but our only 2 options are going to be proximal or distal. So just like lateral medial, we've got this narrowed down to where we know that they're not going to talk about inferior and superior or anything like that. We need to decide if it's proximal or distal. We're talking about the radius. So the radius is closer to the point of attachment, which is the shoulder. And that's why they listed that there for you. The radius is closer to the shoulder than the metacarpals. So the radius is a step closer on your arm to the point of attachment, which is what we relate proximal and distal to. That would make the radius proximal. That would make the radius closer to the shoulder, not further from it. That would also mean that the fibula is lateral, and that is true. The fibula is the one on the outside of the leg. If you already knew that, you got answer choice C, and you didn't have to worry about the first half. If you didn't know that, I'm hoping you at least kind of got to here, and then hopefully the other blank was able to answer it for you. You can always go back and forth. You can get it narrowed down a little bit, get rid of a choice, go check out the other blank, see what you can do with that, go back and forth. 19 is about feedback. So this is a combination of 1 and 5. While exercising, body heat increases, which describes a negative feedback mechanism used by the body to maintain homeostasis during exercise. You do not need to have all these different like negative feedback mechanisms and loops memorized. So if this question frightened you a little bit because you're like, yeesh, I don't have all those memorized, you don't need to. There's 2 key things that you need to have memorized. One of them is actually the next question, which is also from Anatomy 1 and Anatomy 5, which is positive feedback mechanism, childbirth. There are very few human mechanisms that use positive feedback. Positive means the body senses a change, and then the body works to accelerate that change. So if the body is working to accelerate a change, it's agreeing with whatever's happening and it wants to help to have even more of those. If it's a negative feedback mechanism, then it senses a change and it reverses it. It does something that works oppositely from it. So you start to have contractions in childbirth and your body says, oh yeah, let's do more of that. Let's push the contractions closer together. Let's have more of them. Let's keep that going. And that is positive feedback. Negative feedback is, oh, we're getting hot. Let's try to cool down. What you're going to see here, the reason that I'm telling you, you don't need to know a whole bunch about this. Your answers are very narrow. There's one difference in the front part and one difference in the back part of the answer. That's what you're actually trying to determine. So you don't need to know what all the body heat mechanisms are. All you need to do is think about, in this case, blood vessels and whether they would dilate or whether they would constrict, whether they would take blood further from the skin or closer to the skin. So this is just going to be comparative. You're going to use the answer choices here to determine what makes the most sense. So this is more of a logical reasoning question than something you're actually supposed to know off the top of your head. 20, on the other hand, number 20, you do need to know that off the top of your head. You need to know what negative feedback is, but then beyond that, they'll put the answers very close to each other so that you can just say, would this happen or would that happen, which makes more sense just from a totally logical standpoint. So if we get hot, and again, either half of this can be what you start with, would we constrict our blood vessels or would we dilate them? If you know the answer to that, you know that it's dilate. So we would dilate our vessels in the case of getting hot. Give our blood more space to flow as opposed to constrict. We would constrict our blood vessels if we were cold and we were trying to conserve the body heat that we had. You might not have known that. So what you might have done is said, well, if I constrict blood vessels, would that make the blood closer to the skin or would it make it further from the skin? If you constrict a blood vessel, you make it smaller and it pulls further from the skin. So A is a true statement in terms of what would happen if you constricted your blood vessels, your blood would get further from the skin. B is incorrect completely because it says that if you dilate, you move them further. And then you'll find the same thing with C because it says constrict, but then it says closer. So that gets rid of the 2 answers that, regardless of what our body's actually trying to achieve, you have an incorrect matching of mechanisms between the two parts of the answer. So I have B and C out because you cannot dilate and have blood move further from the skin, and you cannot constrict and have blood move closer to the skin. Now that leaves me with, if I'm hot and I'm trying to cool off, which of these two things do I do, constrict or dilate? So if you're hot and you're trying to cool off, you're going to dilate your blood vessels. That's going to release heat, and it's going to move blood closer to the skin, which will allow it to release its heat more easily. This would be if I'm trying to warm up. So once you've determined which mechanisms are actually accurate, then all you have to do is decide, would I warm up if I did this, or would I cool down if I did this, because they'll be opposites. 21, the heart is found in the blank cavity and is surrounded by the blank. So this is going to be 4 and 5. We talked about these in varied levels of detail. Again, you might know one of these better than the other. You might know that thoracic would be the area that the heart would be in, the cavity. That would only help you get rid of A in this case. And then what is it surrounded by? So because it says surrounded by, we can kind of picture, I'm a terrible artist, but here's a heart. And surrounded by, we can kind of picture like that. That's going to be the pericardial sac. There's a couple of hints in there for you. Sac would have the capability of surrounding or containing something. And then peri and cardial together. So peri means outside or outward. And that would be where we would need something that was going to surround an organ, is outside of it. So between sac and pericardial, outside the heart, sac. Basically what this says is outside the heart, sac. That's what we're looking for from a descriptive standpoint. That makes C the best. The apex of the heart refers to like the point of the heart. So it's like a landmark as opposed to being an actual structure. The apex is just the landmark that's at the tip of the bottom of the heart. Pericarditis, hopefully you know that itis from Anatomy 1 is inflammation of. So that would actually mean inflammation of that sac. But we're not going for an action like inflammation. We're going for what is the sac in the first place. So that will make that one C. You may have gotten to that because you knew all of that. And if you didn't, hopefully the wordings and the cavity and whatever else you did have a good knowledge of got you around to the right answer. At what point in embryonic development does ossification in the skeletal system occur? That is at 3 months. You have a chart in your Anatomy 5 class, and some of the things are starred. You just need to know the ones that are starred. Don't even bother with the ones that aren't, other than reading through it once just for some context. Out of all the ones that are starred, which is only a few, ossification is the most common question, in my opinion, that I see my students get. So you definitely want to know, if you know anything about that embryonic chart, start with ossification is at 3 months. Then you can move to a couple of the others, like when you get alveoli and stuff like that. They're all kind of easy to remember, but you have to match them up with numbers. So you really want to be starting with the ones that you're most likely to need to know, so that if you don't get around to memorizing everything, you have the one you're most likely to get asked. 23, which of the following can be found in urine and blood after fertilization is successful, and also the hormone measured with a pregnancy test? So if fertilization is successful, that means pregnancy is occurring. So they just worded that way to make it a little less obvious. And then what is the hormone that a pregnancy test measures? Pregnancy tests can be done with urine or blood, and you can buy them to do at home, which tells you that for some reason, a pregnancy test is very easy to get an accurate read from. The reason that it's so easy is there is one hormone that is in the body of a pregnant female, and it is not in the body of a non-pregnant female or a male, period. And it's that clear cut. And that is HCG. That hormone is only present if you are pregnant. So that is why urine and blood tests can identify yes or no, is that hormone would only be present if fertilization was successful and therefore pregnancy was occurring. 24, and that's from Anatomy 3 and 5. 24, which of the following is correct in listing organs of the upper respiratory system in superior to inferior order? So the upper respiratory is before or above the trachea. I told you to make sure you know that when we discussed Anatomy 5. So if you don't know that yet, make sure you go back and get that down. Upper is, you can't include the trachea with upper or anything that's below the trachea. That actually makes it easiest because you've got trachea there, you got bronchi and bronchioles and trachea there, you got alveoli, which are absolutely in the lower, those are the lowest of the low on the lower respiratory system. So that gets rid of B, C, and D. If you didn't know that, most of these have something wrong with the order that they're in anyway. So you have to be going from superior to inferior. So the cavities that the air actually comes in, and then the throat, and then the voice box, that's in the right order. The trachea, larynx, pharynx is backwards. That would be from inferior to superior. This is correct, but the trachea would come before that if you were going from top to bottom. So they're all in the wrong order in the first place, except for D. D has alveoli. So if you aren't super familiar of where is the line between upper and lower, you probably still would know that alveoli were lower. So the answers are not all that difficult. And you'll find that on the test, especially compared to what I ask you, you will generally find that it is fairly easy to get through the answer choices if you know the things that you're supposed to know. They don't make them super close. They don't make them super hard, as long as you, generally speaking, know what you're talking about. 25, a substance in the body moves from an area of higher to an area of lower concentration by diffusion. This is Anatomy 5 as well. Diffusion is a parent term. Diffusion includes osmosis, but osmosis is too specific in this instance because osmosis is where you have a perfect balance of solvent and solute. We do not have enough info to know that that's what's going to happen here, so we can't say it's osmosis. Active transport would be from an area of lower to higher. It is logical to move to an area that's got more space from an area that's got less space or is more crowded. That is a logical movement to make. So illogical will require energy, which is active transport. Carrier-mediated transport could apply in a lot of different contexts, but you would need some type of information in your question that says that there needs to be a carrier. So just something moving from high to low concentration, that is a logical movement, happens all the time. It's how O2 and CO2 get in and out of your blood. It's how solutes and solvents move in and out of your kidneys. It's pretty much happening all over your body and all your different systems. Diffusion is logical because you're moving from a crowded area to a less crowded area. Anything that is more specific than that, that you know requires energy like choice A does, or that requires a carrier and it requires mediation like choice D does, anything like that, any of those situations are too specific unless they've given you a better description. We don't know what substance this is. We don't know what system we're in. We don't know why it's moving. So we don't have anything as specific as any of the other choices. The only one that is broad enough for how broad the description is choice C. 26, a sudden and complete loss of function in the alveoli would have what immediate result? Hopefully, if you have listened to my descriptions of these question types before, hopefully you took out C and D. We do not have enough information in this instance to say, oh, the blood flow is going to completely stop or the heart's going to stop. If the heart stops, you could definitely say, oh, well, the blood's not going to flow anymore. The heart just stopped because the heart actually drives blood flow. In the case of the alveoli, we need to zone in and think, what is the alveoli's job? Just the alveoli, not the whole respiratory system, nothing but the alveoli. What do alveoli do? They are the site of gas exchange. They are where O2 and CO2 switch places. What's involved in that? The blood, right? So the blood comes into the lungs, goes through the alveoli, diffuses into the alveoli, and while the blood is diffused in the alveoli, that is when gas exchange is happening. So oxygen and CO2 are switching spots on the red blood cells. That's what's going to be affected. So don't look at things that are bigger than that. Look at things that are on that scale. Ceasing of blood flow would be possibly an eventual result because, I mean, ultimately, if your alveoli completely are gone and they completely don't work, that will kill you. So it's not like you can't, it's not like we could say safely that that wouldn't happen. It's just that's not an immediate result of an alveoli not functioning. That would be the result of several things happening, maybe starting with this, but there would need to be more information. So never choose something that's super extreme, like, oh, the whole heart stops, unless you actually have something that sets up that big of a context. That leaves us with inability to bring oxygen into the body or inability to exchange O2 and CO2. The difference between A and B is how big the scale is. A is more like if the lungs don't work, not the alveoli, because the alveoli are not what actually bring air in. Your lungs do that. Air coming in is the responsibility of things other than the alveoli. So if your alveoli suddenly stop functioning, can you still breathe in? Yeah, you can still physically bring air into your thoracic cavity. What won't happen is that air won't exchange with the bloodstream for CO2 and O2. Any question like this, because there's lots of them, this would be considered anatomy 4. Any question that's like, oh, if this disappears, if this stops working, if this happens, you've got to be super specific, super nitpicky, where you're like, okay, only the alveoli have broken. We don't know for how long. We don't know if they're going to stay broken, if they're just going to be broken for 3 seconds. We don't know. So you want to look very specifically at the actual thing and what it is supposed to do on the tiniest possible level. The alveoli do not bring air into the body. If you were speaking very generally, you could say that and you wouldn't be like totally wrong, but you also would be being quite inaccurate. So you want to make sure that you're speaking accurately to the little tiny thing that's actually involved, that you actually have the information about. 27, which of the following is in charge of generating the electrical impulses used to create heartbeat? That would be the SA node. Now you'll notice I didn't put the other node. So there are 2 nodes that are in your heart. One of them generates, the other essentially bounces the signal from the one that generates. So the AV node bounces the signal from the SA node. The SA node generates the impulse. The HESI is not super duper picky about this, so I don't think they'd ever put SA and AV node to where you had to not just remember that it's a node, but which one it is. Again, if you're feeling great, you got your stuff memorized, you can handle a little bit more, certainly go back to anatomy 4 and remember that the SA node is the generator and the AV node is the bouncer. If you're not completely done with all the things that you're trying to master, you don't need to worry about that. What you need to worry about is a node has a very particular name. It's a little tiny spot that you can barely see on a diagram. That's where an electrical impulse is coming from. The other thing I want to make sure that you know, and that's anatomy 4, nervous system is not in charge of generating the heartbeat. When you see generate electrical impulse, you would not be wrong to picture the nervous system. You just have to remember that in anatomy 4, we talked about the fact that the heartbeat is independent of the nervous system. That way, no matter how fight or flight you go, your heart is still beating. So no matter how sympathetic, no matter how parasympathetic your mode is, no matter what your brain is doing, doesn't matter, your heart is going to beat because it can create its own impulse without the help of the nervous system. The nervous system can influence the pressure in the blood vessels. It can influence dilation and constriction of the blood vessels. And in turn, if it influences those, it can influence heart rate. It can speed your heart up or slow it down, but it does not generate the electrical impulses. Any other thing that you're talking about that's generating electrical impulse is totally the nervous system. The only one exception in the entire body where that is happening independently from the nervous system is in the heart. And it's always going to be a node that is doing that. The right atrium is the location of the SA node. So if you thought right atrium, you're picturing it right. You've got the node in the right place, but the right atrium in and of itself does not do anything with electricity. That's the SA node specifically. Which is an example of a hinge joint. That's anatomy 1. In this instance, it's the jaw, and I put this question on here to remind you the jaw is a partial hinge. The actual hinge joints that are 100% hinge that you probably remember off the top of your head are the elbow and the knee. So sometimes they don't put those, just like what I did here, just to see if you really know what you're talking about. So don't forget that the jaw is a partial hinge. If you got confused with D, maxilla is part of the jaw, but it's half of the jaw. So if I'm describing half of a jaw, that leaves out the joint. The only time we have a joint that we can speak of is when we have two different parts of something joined. So if it's just the maxilla or just the mandible, that's not enough to have a joint. That's what would later end up attaching to a joint. Hip and shoulder are both ball and socket. So make sure that you have those down as ball and socket, and then jaw, knee, elbow down as hinge. Those are the primary joint types by a long shot. You don't need to know all your saddle joints and your gliding joints and all that. You just need to know what I just went through. What distinguishes an exocrine gland from an endocrine? This is kind of a new thing that they really haven't talked about up to this point. They just put it on the T's, so I'm adding it to HESI because the HESI will do it next. So if you never saw this and never heard this, don't worry. It's in my new classes. It's in my review class, which I'm about to mention in a moment. But it's not from 1, 2, 3, 4, or 5. So use this question. Don't count yourself wrong on this question if you didn't get it right. Use this to make sure you add that to your knowledge base just in case you actually see this. Exocrine glands have ducts. Hopefully exo and endo stood out to you because we know that exo and endo are important terminologies. An exocrine gland is sending something out. Exo means out. So when you're sending something out, you have to have a duct for it to use in order to leave. So like a sweat gland has a duct because it needs to not only excrete or not only secrete something, but actually take it somewhere. So it needs its own road, and its own road is called a duct. We cannot say with 100% certainty in every single case that every exocrine gland ever in the history of the world is bigger than every endocrine. So that's too big for us to be able to say that. Exocrine glands are not just found in the skin. You have exocrine glands inside your mouth that secrete saliva, and you have them in lots of other places. So that's not accurate. And they are made from epithelial tissue, but we're trying to figure out what distinguishes exo from endo. Both exo and endo, because they are glands, are made of epithelial. So all glands are epithelial tissue. Hopefully you remember that from anatomy 1 because that's an important thing. Glands do secretion. Anything that secretes or excretes or filters or absorbs is epithelial tissue. So glands are always going to be epithelial, but that could cover endo or exo. We're not looking for something to be true in this case. We're looking for something to distinguish two very particular things. Something that I just promised that I would mention before I cut this video off. I have a really intense anatomy review class that I just did, and it goes with my new classes that are not yet put together, that it goes with the next set of curriculum. But it does a really, really good job in many hours. It's like a 4.5 hour class of going back through each and every one of your systems, each and every one of the classes, primarily focusing on 1 through 4 and primarily focusing on big concepts and the universal understandings that you need to have to be really versatile with all these things. It's priced as a regular class. It's 4.5 hours long. It's in 2 halves that you can split up. Has a gigantic packet with it. Some of the notes are the same as original. Some of them are very different and they're brand new and you haven't seen them yet. That is, of course, if you're seeing this video sometime nearby when I'm making it. So it's October of 2018. If you're watching this in July of 2019, the new curriculum is out. So it's going to be the same notes. If you are interested in doing an accelerated, detail-oriented anatomy review and you think that's something that would be helpful, that is available. It's priced as a normal class. You get the 4.5 hours, you get the new packet, all that, all at the normal cost. So depending on how you normally pay me, that's between $35 and $40. And that is a 4.5 hour review class. Believe it or not, even in 4.5 hours, it was hard for me to get to everything. But I got to a huge amount of it. I went through every system and essentially focused on making sure you understand how the systems work, how they connect to each other, what to watch out for in terms of terminology. And then for each system, what are the major things you need to know right off the top of your head? What are the major things you need to be able to picture for really hard questions like the alveoli breaking down kind of question? And all of that is put together so that it's all the systems at once. So if you complete this and you want to do that review, let me know. I'll get that sent out to you. This is designed to be a little bit more of a thinking-based test. So send me your score, but don't worry about your score, especially if you scored well on your second anatomy mock. This was designed to really push your boundary, really challenge how much you know off the top of your head and how much you can picture. You probably did well on a lot of it, but if you did, 70% on this, even if you did 65% on this, that's probably pretty good because most of the questions are not going to be this hard. So every question in this was very, very hard. Very few of your questions, a very small number of your questions are actually this hard on the real one. So this just has a different focus. Hopefully this tells you where you might have breakdowns in your thought processes, where you need to elaborate on what you understand. And that's really the goal of this one. So mock 1 and 2 look very much how the real test will look. This one looks like a much harder version of the real test and hopefully told you where you need to go back and elaborate on your thought processes and your versatility so that you really have every single thing down. So let me know what you ultimately score on this. And if you haven't already, let me know what your scores were for 1 and 2. And that is it. I will see you guys later.